You have a spinal lumbar stenosis, and usually you getting worse each month, each year. In today's video, I'm going to give you something that you never did heard. In my opinion, after 26 years working with the patient, I'm going to give you exactly what is the truth about your diagnosis like spinal stenosis. And your diagnosis is not actually a countdown to disability. You have been diagnosed with lumbar spinal stenosis, and now you're wondering, will I eventually stop walking? Will the narrowing continue until I need surgery? Is disability unavoidable? And here is the long-term truth. Lumbar spinal stenosis does not progress in exactly the same way for everyone, and some people remain stable for the years, and some people experience periods of improvement and worsening, and others gradually losing walking tolerance, strength, or independence. And the diagnosis alone cannot predict your future. The most important factors are not only your MRI looks today, but how your symptoms, strength, balance, and walking ability change over time. And your functional trends tell you a more important story than one isolated scan. My name is Mario. I'm a European medical expert. For the last 26 years, I work with the patient all around the world. And my core specialty is physical therapy and rehabilitation combined with special nutrition and natural remedies. And this is how you really get better in the safe and natural way. But I'm going to give you a couple more information, in my opinion, about spinal lumbar stenosis. Why symptoms can change. The structural changes behind spinal stenosis usually do not disappear on their own, and this may retain thinner, enlarged joints, and the bone spur may continue occupying space, but symptoms are influenced by more than the diameter on the spinal canal. Posture, muscle endurance, inflammation, body weight, movement patterns, sleep, general health, and sensitivity to the nerves can all influence how you feel. And this explains why a person may have difficult month followed by more manageable period. It also explains why two people with similar MRI findings can function completely differently. And the goal is not pretend. The narrowing does not exist. The goal is improve every modifiable factor surrounding it. For everyone who does not already, I have make over 10,000 videos on my other MarioLab health channels. But this is my new channel, MarioLab Physio and Rehab. This is a channel that is especially laser focused on those kind of problems with especially physical therapy and rehabilitation like spinal conditions, arthritis of hip or your knee, osteoporosis, and similar kind of condition. And if you want to learn a lot more about these conditions, subscribe below the video. It's free, and you will see this kind of information regularly on my new channel. 5 signs that the condition may be worsening. First, your walking distance is steadily decreasing. Second, you need longer periods of sitting before the symptoms improve. Third, numbness is becoming more constant instead of appearing only during walking. Fourth, weakness is developing the foot, ankle, or your leg. And fifth, your balance is worsening or you are beginning to fall. And those changes are more meaningful than ordinary day-to-day fluctuation in life. And for more than 26 years, I have worked with spinal and rehabilitation patients, and one of the greatest mistakes I see is measuring progress only by the pain. And pain may be improved while weakness continues, and number one reason why you will almost 100% getting worse and worse is going to be relying only on chemical medication, you rely only on injections, and you rely on some type of non-medical procedures like decompression with chiropractic or similar kind of condition. None of them really works. If those procedure really works, there will be unbelievably small percentage of people with spinal condition. Unfortunately, in the last 30 years, there is over 300% more people with serious chronic conditions. Over 900 million people all around the world suffering for spinal conditions. And I see it, this I really can say. I work with patients 26 years, and almost 99.999% of you drink chemical medications, go to the massages, chiropractical procedures, similar kind of conditions, injections, and what will happen to you? Of course, it's going to be surgery, and in most serious cases, you will have disability for the rest of your life. There is far better way how you can cure yourself. Unfortunately, you don't realize this. What can change your long-term outcome? Do not respond to the spinal stenosis by becoming completely inactive. Long periods of inactivity can reduce muscle strength, endurance, balance, and confidence. But do not repeatedly force yourself through severe leg weakness or intense neurological symptoms either. A long-term plan should be individualized. It may include appropriate rehabilitation, strength and mobility work, modification of painful activities, body weight regulation when needed, better sleep, and anti-inflammatory diet pattern. And treatment, of course, is going to be always focused on physical therapy and rehabilitation with nutrition, natural remedies, and healthy way of living. And in the last part of the video, I'm going to give you two predictions how usually you will be after diagnosis of spinal lumbar stenosis. In the first future, you ignore the condition, you walk distances become shorter, your muscle weaken and you move less because of fear, and everyday activities become increasingly difficult. In the second future, you monitor the correct signs, address modified factors, and seek treatments when functional changes appear. This does not guarantee the surgery will never be necessary, but it gives you best opportunity to preserve mobility and make decisions before several develop problems. And this is something, in my opinion, almost everyone will go to the doctors and you will see injections, operations, chemical medication and other type of treatments, and not single one will be better. You can be with less pain, maybe a couple of months, maybe even for the year, but your problems in your spine will get worse and worse and worse, because none of those type of treatments cannot cure your spinal stenosis, your osteoporosis, your bone spur and similar kind of conditions. It only can temporarily remove your pain, but when you remove your pain, it does not mean anything for your spinal stenosis. If you really want to be healthy, if you have any kind of spinal conditions, call my office for any country in the world. Send us your medical documentation and I will be making sure that you get my special MarioLab program with nutrition and natural remedies for any country in the world. This is especially important if you cannot come to my office. If you can come to my office, even better, we will combine my MarioLab programs with perfect physical therapy and rehabilitation, and this is only way how you will be better and you protect yourself against disability if you have spinal lumbar conditions and any kind of spinal condition. If you want to learn a lot more about 8 signs that you have serious spinal lumbar conditions, watch my video right here. Thank you for following my viewers. See you next time. Bye bye.